Hello students, greetings from Bureau for Health and Education Status Upliftment, constitutionally entitled as Health Education Bureau. In this video, we are going to perform virtual experiment related to pharmacology, and for that purpose, we are going to use experimental pharmacology software. So right now we are on the page of experimental pharmacology software. First of all, we have to enter our username in this section. Further, we have to enter our password in this section. And then we have to click on this login option.
Now we have entered to the main section of our experiment. Here you will observe that two options are here, theory option and practice option. In practice option, we will perform all the blood withdrawal techniques by in silico methods. Here we will not perform any physical method. We will only perform in silico methods with the help of XPharm series software. But before starting practice of these techniques, we have to be clear about the theoretical section of all withdrawal techniques. So if we click on this option, so detailed introduction about what is blood collection and why it is required and how many types of blood withdrawal methods are present in rodents and the detailed procedure for each method is available in this section. So blood collection is very common requirement for experimental pharmacology procedures. The method of blood withdrawal in mice and rat basically depend on two factors. First factor is how much volume of blood needed. Second, frequency of the sampling. So basically these two factors affect the selection of blood withdrawal technique. There are many techniques which are commonly used to collect blood from rodents like retroorbital sinus blood withdrawal method, tail snip blood withdrawal method, tail blood withdrawal from tail, intracardiac blood withdrawal, posterior vena cava blood withdrawal, Siphoneous sampling from medial or lateral approach, submandibular sampling, jugular vein sampling, dorsal metatarsal vein sampling. Siphoneous submandibular, jugular vein and dorsal metatarsal vein sampling are collectively known as miscellaneous methods. Here, detailed procedure of each blood withdrawal method is also available in this section. Like for retroorbital blood withdrawal method, if you want to go for next procedure for other method, so we will click on this next page option. Here, next procedure for tail snip blood withdrawal procedure, for tail blood withdrawal from tail procedure, we will click on next again. So here, detailed procedure for cardiac blood collection, detailed procedure for posterior vena cava blood withdrawal method. And if we click on next option, so here miscellaneous methods are also available. So we will click on practical option from here. Now you can see in practice section, 6 options are available. We will understand and we will practice about blood withdrawal methods one by one. So at first we will click on retroorbital blood withdrawal method. And this section is having 3 buttons, theory button, video button and practice button. So at first we will click on theory button option. Here stepwise detailed procedure is available for physical methods, but here we are performing only in silico method. In detailed procedure, first animal must be anesthetized with the inhalation anesthetic drug. Here we can use isoflurane in bell jar. Once the animal is affected fully, with anesthetic drug. The eye is protruded by placing a finger on the top of the head and along the jawline. The capillary tube further is placed in the medial part of the eye at a 40 to 45-degree angle. Then apply pressure by gently rotating the hematocrit tube. This will cut through the conjunctival membranes. Further, blood will flow into the hematocrit tube by capillary action. Once blood begins to flow, maintain pressure to keep the eye protrude. After collection completes, to stop bleeding, release the skin and allow the eye to return to the normal position. So this is stepwise procedure. Here we will understand this detailed procedure by video option, in which administrator will perform same experiment, same procedure. Here you can clearly observe that now administrator is collecting blood via hematocrit tube with capillary action. Further, we will click on practice option. We will perform the same experiment but by in silico method. Here you can see the option, click on capillary tube. This is image of capillary tube. We will click on it. Now this capillary tube has been inserted into eye region. We will click on capillary tube again. Now you can see that blood has been collected in capillary tube by capillary action. So this retroorbital blood withdrawal method has been done. So we will click on this back option. Next we will go with tail snip blood withdrawal procedure. We will click on it. Now you can see three options: theory, video and practice. We will start with the theory section, in which stepwise detailed procedure is available. You can easily understand this procedure here. Like, animal is placed into the restraint tube such that the tail is accessible. Further, tail is wiped with the slight warm water. For the tail snip, the tail is extended and the end of the tail, for example, 0.5 to 1 mm in case of a mice and up to 2 mm in case of a rats, is cut with the scalpel with 10 to 15 number. We will use this number scalpel only. The cut is made over the lateral tail vein. The tail can be stroked from rear end of the tip to encourage the blood flow. The blood further is collected from the tip using hematocrit tube, or blood allowed to drip from tail directly into the collection wire. So this is the detailed procedure here, and we will click on video option, in which administrator will perform the same procedure. Here administrator is creating a cut on tail by scalpel, and now it is collecting, he or she collecting the blood from tail region with the help of capillary tube. Now we will click on practice option. We will perform the same procedure but in silico method. Here you can see that experimental object is placed in restraint tube, but the tail is free, it is accessible. So we will click here on knife. So now again we have to click on knife. It will create a cut here on tail region. Now we will click on this capillary tube option. So capillary tube here near to the tail region. Now we will click on capillary tube again, and now blood has been collected from this cut region of tail by capillary action with the help of capillary tube. So that's how procedure for blood collection from snip has been completed. We will click on back option again. Now we will go for third method, which is tail blood withdrawal from tail. We will click on it. Again, three options are available. We will go with theory section first. We will click on it. Here, detailed procedure is available, which we can easily understand that animal is placed into the restraint tube such that the tail is accessible. Further, tail is wiped with the slight warm water. For blood withdrawal, the tail is extended and blood is collected by syringe. The tail can be stroked from rear end of the tip to encourage the blood flow, and the blood is collected into the syringe. This detailed procedure will be followed by the administrator in this video section. So we will click on this. Here you can clearly observe that experimental object is placed into this restraint tube. Here, tail region is free and administrator is collecting blood from tail region with the help of this syringe. We will perform same experiment here. We will click on practice option. Here our experimental object in restraint tube and tail region is free here, and we have to collect blood from this tail region with the help of this syringe. So we will click on this injection image. Again we have to click on injection image, and now you can clearly observe that blood has been collected from tail region with the help of syringe. So this procedure has been completed here. Now we will click on this back option, and we will go with fourth blood collection method, which is cardiac blood collection method. We will click on it. Now we will click on theory option. To understand the detailed procedure for this method, the animal is restrained by the scruff with the body hanging vertically. The needle is protruded in the notch just to left the animal xiphoid. The needle shall be kept parallel to the spine and placed just under the ribs. Further, place the needle protrude up into the chest and puncture the heart. Apply slight pressure through the syringe, and if the needle is in the heart, blood will flow automatically into the syringe. So we have to wait until the blood gets filled in the syringe before adding more pressure on the syringe. Here, 2 points need to be noted that if you are collecting blood from the mouse, so we can use 3 cc syringe with a 22 to 25 range gauge needle is preferred. And for blood collection from the rat, 10 to 12 cc syringe with an 18 gauge 1.5 needle is preferred. So this is the detailed procedure for cardiac blood collection, and administrator will perform the same experiment in this video. So we will click on it. Here you can clearly observe that administrator is performing the same procedure and collecting the blood from cardiac region. Now we will click on practice option, in which you can clearly observe that in this image, administrator is hanging this experimental object, and we have to click on injection option. Again, we have to click on injection option. Now this injection is collecting blood from cardiac region. So that's how experiment has been done by in silico. We will click on back option, and now we will click to the posterior vena cava blood withdrawal method. And at first we will understand the theoretical section of this experiment. We will click on it. So animal is placed on surgical platform, dissection tray we will use, and we will give animal anesthesia by inhalation or by injection method, and we have to be ensure that animal is completely anesthetized as determined by toe pinch or tail pinch. Then skin is lifted. After confirmation, we will lift the skin, and a small transverse cut is made through the skin just above the pelvis in the females or just above the prepares in the male. The muscle is lifted and a small transverse cut is made through the muscle just above the skin cut. Cut transversely along the side of the ribs on the both sides. Gently protrude the intestines to the animals left to expose the posterior vena cava. Then insert the needle, protrude upward into the vena cava midway between the joint of the renal vessel and the iliac bifurcation. Slowly withdraw the blood by applying pressure on the liver. So this is the detailed stepwise procedure to collect the blood from posterior vena cava. And this detailed procedure will be followed by the administrator in this video option. So we will click on it and we will observe, we will watch the detailed procedure here in this video. So administrator first gave the anesthesia to experimental object, then he or she created the cut. Now syringe is basically placed in the required area of vena cava and collecting the blood by pressuring on it. Here we will perform the same practice by in silico method. So we will click on practice option. Here the dissected area exposing the vena cava region, and we will click on injection option here. And again we will click on injection option. So blood is now collecting from posterior vena cava region. And that's how this blood withdrawal method has been practiced. So we will click on this back option again. Now we will go to the miscellaneous methods. We will click on it. So in addition to methods discussed above, following methods are also used for blood vessels. We can collect the blood with the help of siphoneous sampling. In this method, blood is collected from siphoneous vein of the leg of the rodent, because siphoneous vein is basically present in the legs that help send blood from the legs and feet back up to the heart. And blood also can be collected from submandibular sampling. Submandibular gland is basically secondary largest of the three main salivary glands. So blood can be collected from this region also. And third one is jugular vein sampling. So blood can be collected jugular vein of the neck region, because jugular vein is present in neck region. And dorsal metatarsal vein can also be used for blood collection. So blood is collected from metatarsal region, and this method is basically preferred in the rat only. It can't be preferred for the mice. So now all the blood withdrawal techniques has been discussed, had been practiced in this practical session, which is available on XFarm series software. So now we will click on back page option. Again, we will click on back.
To subscribe this software, please visit to the official website of Bureau for Health and Education Status Upliftment, which is www.heb-nic.in. Thank you.